By the look of the queues, residents in Sefton are taking the Indian variant seriously. They're waiting to be tested, one of the tools that's been deployed here to try to get infection rates under control.
A bit worried, really, now this new virus is hitting the town. I think we all have a civic duty to come and get tested.
As an area we were very, very low. Then all of a sudden there was a scare at the local swimming baths, and before you know that, 2 schools were closed.
So concerned by the rapid spread of the variant, the Prime Minister conceded the end of lockdown may have to be pushed back.
I have to level with you that this new variant could pose a serious disruption to our progress and could make it more difficult to move to step 4 in June.
Last week, just 520 cases of the Indian variant had been reported. Since then, they've more than doubled to over 1,300. This graph shows why the speed of its spread is causing scientists to worry. Unlike any other variant, it's taken less than 50 days for more than 1,000 cases to be identified. Although there's no evidence it causes more severe illness or evades vaccines, anyone over 50 or at risk will now get their second dose sooner.
For people who are really quite vulnerable to the disease, that extra bit of protection that the second dose gives you from 85 to 95% is important, because that extra level of protection will reduce the number of people ending up in hospital and sadly dying of the disease.
Just days before restrictions ease further on Monday, questions then about how safe it is to visit family in hotspots.
Do you say that they should still go, and should they stay the night?
Given the caution that I think we have to exercise with this new variant, the risk of extra transmissibility, I would urge people just to think twice about that.
There's every chance easing of restrictions will now lead to a rise in cases, with now obvious implications for the end of the roadmap.